Hello everyone, I am Dr. Kelechi Eguzo and today I'll be guiding you through the summary of our slides on introduction to breast cancer. Uh, at the end of this topic in the course, we hope that you will understand the epidemiology of breast cancer both globally and locally in Nigeria, and you also understand the risk factors, the natural history of breast cancer, and you understand how breast cancer is classified, and also to you get to understand the current guidelines regarding breast cancer screening. Now I have to emphasize the classification because as the person who might end up being the first to make a diagnosis, or at least a clinical diagnosis, you need to have an idea of what kind of cancer or what stage of cancer you might be dealing with. Okay, so just an overview, and there are lots of slides after this overview in the handouts that you would get online. So breast cancer is a malignant growth, malignant growth in the breast tissue. So basically, the breast tissue grows in a way that it was not supposed to grow. And if you go back to the anatomy, we had ducts and lobules. So breast cancer usually starts from either of those two, the ducts or the lobules, and it's becoming an increasing problem in Nigeria, and that is why we are bringing you this course. So there are a number of slides on epidemiology, and the things I needed to understand is like this is the global epidemiology anyway, is that breast cancer varies a little bit in terms of geography, which is geography like Nigeria versus US, ethnicity, that is black people versus non-black people, and there's also some racial variations there. So if you look at this data here, okay, so if you look at this data here, you see that white women tend to have more, versus then followed by African American women, whereas American or Native American women are having least incidence. Now, although there's a lower incidence of breast cancer among African Americans, including Nigerians, we tend to have it earlier. So it usually starts around 40 years for us. And when people with breast cancer in our parts of the world, they come with advanced disease that is like from stage 3 and above. And now cancer is more aggressive, meaning it grows faster, it's more vicious. So survival of breast cancer among black people is lower due to several reasons. That's one of the reasons why we have brought this course your way, so you can appreciate these facts and act faster with better information and knowledge. So what are the risk factors for breast cancer? There are quite a number of them. You would have obesity, high cholesterol, high chest dose radiation, and quite a number of factors. The family history is one of the strongest factors, and the reason that one is a woman is another factor. In the course, there are lots of risk factors that we've explained, so take your time to go through them. Then there are lots of slides regarding clinical features of breast cancer. How do you get to see breast cancer? Early disease of breast cancer may not be obvious clinically, meaning you can't quite see it or feel it with your hands. But that's why people do mammography to find early disease. But then when there is disease that you can feel clinically, it most often comes as a painless mass in the breast, and there are some changes associated with that. So you find changes like thickening of breast tissue and dimpling. We talked about that in the earlier presentation regarding breast anatomy, and you can find pudorant changes. So when you go through the slides, you'll find more information about clinical of breast cancer. Now, when you see a woman that has breast cancer, I'd like to introduce you to this important tool called the breast cancer risk assessment tool. So this is like a tool that is used in counseling for for you to for you to help a woman understand her risk for having breast cancer in the next 5 years. I'll encourage you to check out this link when you go through the materials. it will be good for you to understand how this works and counsel women better regarding their risk for developing breast cancer. So there are lots of slides talking about breast cancer risk assessments in the course. Now, when you see a woman, when you see breast cancer clinically, it's important that you make a decision regarding the stage of the cancer. So breast cancer is staged from 1 to 4, as you can see here on the left. And then we can broadly classify those stages into early breast cancer versus late breast cancer. And here you find the measurements based on tumor size. So breast cancer staging is done based on three things: the tumor size, the number of nodes involved, and the metastasis to distant organs. So a combination of these three components, tumor, nodes, and metastasis, will give you staging information. And so there are lots of slides that have kind of described how breast cancer is staged. So that essentially is what this topic is about. And in summary, when towards the end of this of the slides, when you go through them, you find that uh, there is there is breast awareness, which is like talking about doing the breast self-examination. Then the next thing that we need to do as clinicians is to offer periodic clinical breast examination, probably between every 1 to 3 years for every woman, and also do ultrasound and mammogram as much as possible. And then we should start screening people earlier for those at risk of breast cancer when we've used the breast risk assessment tool that I introduced a while ago. So this topic is very rich, and I really encourage you to dig into it and ask questions in the discussion group, and we will see you there. Thank you.